Right. So if you have read and understood, considering its surgical and administration, kindly identify the region, please, here in the left-hand side. Yes.
That's the femoral triangle.
Okay. Can you tell me how femoral triangle is formed? What are the boundaries?
So that's number 13 is the inguinal ligament. But
10.
What?
I think it's, which ones you said?
13.
13.
The superior border, yeah.
Yeah, that is 13. Yes. Okay. Can you tell me the attachment of inguinal ligament?
The what?
Attachment of inguinal ligament.
So it's attached to the anterior superior iliac spine, and
okay.
yeah.
Yes. Can you also please tell me the rest of the boundaries of the femoral triangle?
Okay. The lateral border, that's the sartorius muscle. That's number 9.
Yes.
The medial border is adductor longus. I'm not sure.
Adductor longus and pectineus. Medially.
Okay,
no, medial merger of adductor. Yes, you are right. Adductor longus. Okay. How the floor is formed? I was telling the floor. I was telling the
formed by the adductor longus.
If you can tell me the floor of the femoral triangle from medial to lateral, please. What are the muscles? Yes.
The muscle. There are 2 muscles. The medial one is the adductor longus muscle. And then the second one I cannot remember. Sorry.
I was telling you wrong. And then the lateral muscle is iliopsoas.
Iliopsoas. Okay.
Oh, can you please tell me the contents of the femoral triangle from lateral to medial?
So the most lateral one is the nerve, femoral nerve.
Yes.
Then we have the femoral artery.
Yes.
We have the femoral vein.
Yes.
And then the lymph nodes, the deep.
Yes, lymph nodes and the lymphatic. Okay, can you tell me, we cannot see here because it has been dissected out. Can you please tell me how the femoral sheath is formed? Tell me everything about the femoral sheath.
What I know about the femoral sheath is that it's divided into 3 compartments.
Right.
3 different compartments that extend into the femoral canal, adductor canal, and one other canal. But I'm not sure what forms it superiorly.
Okay, it's the extension of what? How this femoral sheath is formed?
I'm not too sure, I'm afraid.
Okay, it's actually the downward extension of prolongation of transversalis fascia and iliopsoas fascia.
Okay.
Right, and then can you tell me how long is it?
Ooh.
And what is the shape of femoral shape? It's funnel shape, it's 3 to 4 centimeters.
Funnel shape,
3 to 4 centimeters in length. Okay. Can you please tell me, you told me the compartments. Can you tell me the contents of the compartments?
For the femoral canal.
Yes.
The femoral artery, is it? Or no?
The most medial compartment has or constitutes the femoral canal. And the medial one contains the femoral vein. And the lateral one contains the femoral artery. Okay. Can you tell me about the femoral canal?
In terms of
can you tell me about the boundaries of the femoral ring? How the femoral ring is bounded?
No, I cannot.
Okay, can you please tell me the most medial compartment of the femoral triangle has one physiological and one pathological importance or significance? Would you be able to tell me that?
Yes. the because the femoral vein is the most one of the most medial parts of the femoral triangle.
Yes.
When there's an aneurysm or a swelling, there's a tendency to collect into that anatomical space, and then femoral lymph nodes inflammation are also usually typically found in that space as well.
Okay, physiological significance was the femoral vein expansion, and the pathological significance would be that since it's an empty space, that could lead to or give rise to hernia.
Okay.
Okay.
Yes.
Can you, would you be able to identify this on the right hand side? There is an image, and if you can identify 21.
21 looks like it might be sartorius.
Yes. Can you tell me the attachment of sartorius, please?
Proximal attachment might be the iliac, anterior superior iliac spine.
What is so important about this sartorius muscle?
It's important for the external rotation. It's the longest, one of the longest muscles.
Yes,
in the
and crosses two joints. And okay, you tell me next time.
Knee flexion, does it?
Can you identify this structure? It says 6 here, and then 14, 12, and then 14.
Vein artery. So femoral artery.
Okay, can you identify this 17 over here?
Pectineus muscle.
I don't know, I'm asking because you have to think if you're going from medial to lateral or lateral to medial. Then what is this 8?
8 is the vein.
Okay, good. If it is, this is vein, then this is artery, and that would be the so this can be pectineus, like you're telling. Okay, what is this 2?
2 would be the adductor longus.
Okay, can you please tell me the boundaries of adductor canal?
The floor is adductor magnus. The medial border is the adductor longus. I'm not sure. I think I've mixed it up.
Yeah, you did. Can you, okay, please tell me the contents of the adductor canal.
Oh, no.
Okay. Right. If you can tell me why adductor canal is called adductor canal.
Why it is called the adductor canal?
Yeah. What are other names to adductor canal? Can you name other 2 names? Or how many names can you name?
No.
It is also called subsartorial canal or Hunter's canal. And why is it called so? Because it runs from the apex of the femoral triangle to the popliteal fossa, and it's like, it's the adductor hiatus from the adductor muscles.
Okay.
So if you look at the image in the books, then you realize that femoral vein and then femoral artery, and then just below them there is adductor canal.
Okay.
And it's between vastus medialis and then rufus sartorius and posterior adductor longus and adductor magnus. All right, you'll tell me next time, doesn't matter. Would you be able to tell me the images that you're looking at right now? If not, then doesn't matter, we can do it next time.
It looks like the femoral artery, and it's
which one? This one?
Yes, the one on the left. This one, the first one.
Okay. Yes. Then otherwise we can do it next time. Doesn't matter. Just
we can.
Okay. Would you be able to comment on the right hand side image? What is it?
English is,
Femoral arteriogram.
yeah.
Okay. And this one is the catheter, which has been introduced. And the 2 is the common femoral artery. 3 is the, if you know the branches, the lateral circumflex femoral artery. 4 is the medial circumflex femoral artery. 5 is the perforating branches over here. 6 is the profunda femoris, see the big one. And 7 is the superficial femoral artery. That doesn't matter. We'll repeat this several times, so you'll know it next time. We'll do. And this is like medial and lateral, and then you have to know which vessel is that and what are these branches. We'll learn
Okay.
next time. Yeah. Good.
Okay.
Thank you.